So I've been tasked with doing this PSA. Someone asked me to do this in the comment section last week, and this nice lady wrote up this nice write up for me to introduce what is going on. People may not be aware, but it could be happening at a hospital near you. She says women and girls are being SA'd by the millions and don't know it. If you go under anesthesia for any reason, you may be used as a training dummy for medical students to practice on your rectum, vagina, and breasts. This happens even if you are fully clothed when you went under, even if you're just having your tonsils or a mole removed. Look up The Flying Kitchen by Shannon Vavich on YouTube. Shannon is a survivor and activist. She was assaulted this way and has videos about it. Women and girls have woken up bleeding because they will have a whole room of medical students practice pelvic exams on them. Congress made it mandatory to get consent, but now they hide it in the small print and word it as training. You have to opt out to stop it. If you don't, it is 100% legal to undress you and put you on display and have 30 guys come in and finger you for medical practice. It is not in your charts. So if one of them injures you, just a side effect. Please pass it on. I've actually seen Shannon Vavich's video on TikTok. She does great work. And they said, she is on both TikTok and YouTube. So this article flew under my radar. I didn't know that this came out this past April. I just missed it. Hospitals must get written patient consent for pelvic exams, federal government says. And like the lady typed up for me, they hide it in the fine print. When you go under anesthesia, you have to know to ask or tell them that you do not consent. You do not consent to have a pelvic exam while you are under. This woman pictured is Ashley White's. She was given an unauthorized pelvic exam. So she is the subject of this particular article. The Department of Health and Human Services said Monday that hospitals must obtain written informed consent from patients before they undergo sensitive examinations such as pelvis and prostate exams, especially if the patients will be under anesthesia. A New York Times investigation in 2020 found that hospitals, doctors, and doctors in training sometimes conducted pelvic exams on women who were under anesthesia, even when those exams were not medically necessary and when the patient had not authorized them. Sometimes these exams were done only for the educational benefit of medical trainees. I want to remind people that if there is no consent to somebody putting something in your body, what is that called? What is that called when there is no consent? When somebody cannot consent because they are drugged? What is that called? On Monday, the Secretary of Health and Human Services, along with top officials from the Department's Center for Medicare and Medicaid Services and the Office for Civil Rights, sent a letter to the country's teaching hospitals and medical schools denouncing the practice of doctors and students conducting the exams without explicit consent. The department is aware of media reports as well as medical and scientific literature highlighting instances where, as part of medical students' courses of study and training, patients have been subjected to sensitive and intimate examinations. It is critically important that hospitals set clear guidelines to ensure providers and trainees performing these examinations first obtain and document informed consent. The department issued a set of guidelines clarifying a longstanding requirement that hospitals must obtain written informed consent as a condition for participating in Medicare and Medicaid programs. Patients who are participating in future clinicians' education should be aware, should have the opportunity to consent, should be given the same opportunity to participate in that education that they would be given if they were awake and fully clothed, said Ashley White, who underwent an unauthorized pelvic exam while she was under sedation in an emergency room. We can only expect to have better trust in medicine when both patients and providers can expect a standard of care that prioritizes patient consent. Okay, so here is another article that came out on April 1st as well. The new HHS guidance requires consent for pelvic, breast, and other sensitive examinations. So some of this stuff overlaps with the article before, but I wanted to go over this highlighted part. There wasn't a clear federal guideline about this. So there were individual state statutes. So it says, in the absence of clear federal guidance, these exams have been regulated by individual state statutes. As of 2021, 14 states had rules protecting against non consensual exams of anesthetized patients, according to a study published in January 2022 in the journal Annals of Surgery Open. These rules vary greatly in scope, often protecting only female patients from exams without consent or extending only to medical students and trainees. The new HHS guidance harmonizes and expands these protections nationally, and it lists in detail the requirements for patient consent. The guidance says that a well designed consent form must specify the name of the hospital, the procedure, the practitioner performing the exam, the benefits and potential side effects, the name of the practitioner who informed the patient about their consent rights, statements from all other physicians or health professionals who might perform exams, clarifying they will limit the scope of the examination to what is expressly consented to, and witness signatures. We want our students to have access to these exams so they can learn and go on to be good physicians, but we can't forego patient care just so that they can have education. We also can't ignore the medical education happens on a lot of vulnerable people, Black women, said Keisha Ray, an associate professor with the McGovern Center for Humanities and Ethics at the University of Texas Health Science Center at Houston. The guidelines, she said, are a welcome step that could help restore trust between the Black community and the medical establishment. I'm sure that you all know, or maybe you don't, that Black women, Black slaves our bodies were used to perform experiments and all kind of things so that they could take those experiments and those techniques to a wider and wider public. So and then not even in slavery times when Black people were actually free but just poor, or they may be in a community that goes unnoticed or uncared for, their bodies were used. So this is why this person specified Black community. A lot of the information that we know about gynecology and a woman's body has come from Black women being used as guinea pigs as experimentation, said Ray. A lot of these examinations that happen while patients are anesthetized are at teaching hospitals, and they tend to be state hospitals or public hospitals where a lot of their clientele are still low income Black women. She added that the Black community has long complained about unwanted examinations and lack of consent, but these concerns have routinely been ignored. And while she endorsed the new guidelines, Ray said that there are additional safeguards she'd like to see implemented. For instance, hospitals need to set up anonymous channels to report misconduct. I know a lot of students, they'll want to say something that they saw was wrong, but they're worried about their career. So there has to be a way to do anonymous reporting that is not going to have some sort of whistleblower blowback on individual people. Now, here's the woman, Shannon Vavage, that I was told to check out, and I've actually seen her videos before. She is talking about non consensual pelvic exam under anesthesia. That is something that we need to talk about and know and understand because it is legal in half of the states. She shares her stories on both TikTok and YouTube. She has both a TikTok and a YouTube page, and I'm going to make sure to tag her if you want to hear a longer version of her story and the things that she went through. She lives in Germany now, and this practice is illegal in Germany and the UK, she says, but it still needs to be illegal in all 50 states here and federally run military hospitals. Many of those people get no recourse. Their bodies are just used as experiments and teaching tools, and women do not have agency and they have no recourse. So follow this woman, Shannon Vavich of the Flying Kitchen, I believe, and I'll make sure to tag her pages so you can find her. like, comment, share.
Non-consensual pelvic exam under anesthesia is a practice where a woman's body is used against her knowledge and against her consent as a teaching or research tool while she is under anesthesia for a surgery that can be completely unrelated to gynecological surgery. This is an abhorrent practice that should have been made illegal 50, 60, 70 years ago. Nonetheless, it is still being practiced in half the states in the United States and on the federal level in military hospitals. This happened to me in 2017 when I underwent a routine appendectomy. It had massive consequences on my feelings of safety and well-being. When I woke up from general anesthesia and noticed synthetic lubricant in the pelvic region, when nobody gave me any warning, I'm sure I did not give consent for anyone to explore that region of my body. I was gaslit. I was psychologically abused. I ended up getting a grape kit done that day after nobody gave me any answers. NCIS took my case and a 20-month investigation was launched into the hospital. What I did not know at the time, and what NCIS did not know at the time, and what almost no one knew at the time, is there is something called non-consensual pelvic exam under anesthesia. The medical establishment has kept this as a closely guarded secret. If you would like to know more about my story, go to my Clock app or go to my private Facebook group. The medical establishment is not going to outlaw this practice on their own. They need pressure from us to let them know that this is not okay with us. This is illegal where I live now in Germany, and it's illegal in the UK. It needs to be illegal in all 50 states and in federally run military hospitals. Follow for more. Thanks very much.